Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita. Ron will not be joining us today.
And I'm Jean Marie.
Collectively, we're the hosts of PodcastDX. On today's show, we're speaking with Katy Grainger about septic shock. Katy, about 4 years ago, at the age of 52, her life was turned upside down when she nearly died from septic shock because of a small infected cut on her thumb. And she's going to tell us more about it today. Thank you for taking the time to join us today, Katy.
Hi, Katy.
Thank you for having me. It's such a pleasure to be here. I've been enjoying your podcast.
Oh, thank you.
How is the weather there in Hawaii?
Okay, so I'm in Seattle right now. I spend part of my time in Seattle and part of my time in Hawaii.
Okay.
So you can guess which months I go which place. But
Yes.
I'm in Hawaii pretty much from Christmas through May. And then when it starts getting really hot there, I come back to Seattle.
Okay.
And I get to enjoy the beautiful summer months. So it's actually lovely here today. And the summers here are among the most beautiful in the world, I think.
Great.
Partially because we spend, if you spend the winter here, you are doing it underneath cloud cover very often. So it's just nice to have the sunshine, and it's been a lovely summer.
Those are Lita's two favorite places.
Yeah. I love Hawaii, and we're going to the San Juan Islands next week.
Yep. So.
Oh, that's wonderful. Lita, where are you? I don't even know where you guys are.
Chicago.
Yeah,
Where
just outside of Chicago.
Okay. Good. Well, I'm glad you make it out here. The San Juans are gorgeous.
Oh, love it,
and
love it.
I absolutely love Hawaii.
Yes.
And hi, Katy. It's Jean Marie. And I just want to say that if we have our druthers, we'll be following your example because couldn't get better.
Right.
Could you walk us through what happened 4 years ago? Absolutely. So I'm coming up on my 4-year anniversary in September, but I will walk you through it.
Okay.
So I had been visiting my daughters in college. I was living in Hawaii at the time. My husband and I and my children had moved there, had been living there for 10 years. And at this point in time, it was 2018, September, and both of my daughters were away in California. My oldest daughter had just graduated college the prior May and was starting her first job. And then my younger daughter was just starting her junior year. Okay. So I had come down to visit them in California, had done this little loop through Seattle, seeing my friends here, and had got on a plane, headed home back to the island of Kauai, which is one of the smaller of the outlying Hawaiian islands. And when I landed, I noticed a kind of pinkish purple bump on my thumb. It was not very big. I would say like the size of a mosquito bite, but it was oozing a little bit of fluid. Just a clear fluid. It just seemed unusual. And we had a large flood there a few months prior. So we were on the lookout for infections. Everyone was being real careful, knowing that in the flood waters, we could get an infection. And actually the word sepsis had been thrown around a little bit because we all recognized that there was something that could happen beyond an infection where you would get really sick. No one really knew the details, I don't think. I mean, there might have been a few people, but I did not know all the details. But I just knew that I could get really sick from an infection. So I thought on my way home, I live an hour from the hospital. Okay. So I thought on my way home, I'm going to go by an emergency clinic and get it checked out. I did that. I went in. My vital signs were strong. This is important to notice because I was not exhibiting any of the symptoms of sepsis at this point. I had a strong heart rate, strong blood pressure, strong breathing rate, and my temperature was normal. So they looked at the thing on my thumb and said, yeah, it does look a little unusual. They gave me a prescription antibiotic, which would have treated it if it was MRSA. It would have been able to kill the MRSA. And then they gave me an oral antibiotic since it was a weekend and said, if it seems a little worse tomorrow, go ahead and start taking the antibiotic and let us know if it's not getting better. So they kind of gave me that traditional warning that you get when you visit a doctor's office. And I just know from my past experience that I'm sure I took that document, threw it on the seat of my car, and then just never looked at it again. So I headed to the pharmacy. I picked up the prescription that I needed. And while I was there, I grabbed a thermometer because in my mind, I thought if I'm going to get sick from an infection, surely I'm going to have a fever. Well, it turns out that this is not actually accurate. And I'll talk about that in just a minute.
Okay.
So I got home over the weekend and I was taking my temperature. I will note now that I don't really have memories of the weekend. I think it's because of the things that happened afterwards. I was put in eventually into an induced coma. And so I think that right there kind of just messed up my memories for the weekend. I was aware of what was happening at the time, I think, based on what my friends have told me. But I just, for whatever reasons, I don't remember it. So I do know myself well enough to know that over the weekend, I was taking my temperature and it was coming back what I was registering to myself as normal. What I know from my past experience is that if I take my temperature and if it's under like 97 degrees or, 98 degrees, I just assume I didn't leave it in long enough. But I leave it in long enough that I figure if I had a fever, it would register. Okay. So I was not really being as accurate as I could have. And I never had understood that you could have an illness with a low temperature. So I now know that to be true, that if temperature under 96.8 degrees can indicate that you actually have a low fever or a low temperature, and that can be a cause for a trip to the hospital, just to check and make sure everything's okay. So I missed that symptom. I was sleepy from my travel. And so I told a couple people via text that I just got home. I've been traveling. I'm just kind of tired. I'm just going to lay in bed. I'm not, not feeling 100%. I just said, I have this cut on my finger, I'm sure I'm fine. And I just sort of rested the day away. And I suspect that I slept most of the weekend. I took an antibiotic on the second mornings on Saturday. And I know this because I sent my husband a note. I had told him about the bump on my finger and I sent him a photo. And he was in Idaho on a fishing trip. Okay. So he was out of the state. My children were in California and I was home alone. Oh. So I had texted him and I was sort of keeping in touch with them, just saying, hey, I have this little bump. It's weird. I'm having it looked at. I'm doing what I need to do. But I told him, I said, I threw up today, but I'm sure it was just because I took an antibiotic on an empty stomach. So that tells me two things. It tells me that I took the antibiotic, which means that the thing was getting worse on my finger. And so I was taking it upon myself to start the medical treatment that was sort of the next step. But I wasn't paying enough attention to realize if it was getting bad enough to go to the emergency room, or I didn't recognize these other symptoms. I didn't heed the signal that my body was throwing up. Maybe it was because of the infection. I sort of wrote it off. And I think that that's something, I know women especially tend to do that, right. But I think we sometimes minimize our symptoms. So one of my messages is please don't minimize your symptoms. Okay. Be honest with the people around you and really keep track of what's happening. Okay. So then I went to bed that night. So right there, I've had this fever is kind of indicating that there might be a problem. I knew I had the infection. And I'm extremely sleepy, which can be a sign of one of the signs of sepsis, which is mental decline. And then at this point, I wasn't feeling really sick. I think I was just tired. So I went to bed on Saturday night, but then I woke up on Sunday morning and I texted my friend and said, and this is at the crack of dawn. So it's very early for me. This would be unusual behavior. At the crack of dawn, I texted my friend and said, can you please take me to the hospital? And she said, well, can we just go to the emergency room? I said, no, we can't. I have never been so sick. Those were the words I used. So I'm just going to go ahead and tell you with sepsis, we use an acronym TIME, T-I-M-E. And I mentioned temperature, which can be high or low. Okay. I is for infection. Sepsis always happens with an infection. M is for mental decline, which can include sleepiness. That's a pretty subtle sign though. Oftentimes it might include other symptoms like being disoriented, seeming kind of drunk, or even seeming like I have dementia. That would be a real sign of mental decline. And what that's showing us is that your body is low in oxygen. And then the final symptom that often happens with people with sepsis is they say something like, I've never been so sick, or I feel like I'm going to die. They're extremely ill. And if anyone ever says that, I always tell everybody, get them to the hospital. Trust a person's instincts. If they're saying that they're that sick, get them checked out. Even if they can't tell exactly what's wrong. Right. I mean, it's like, sometimes we just know. Right. Yeah. Yeah. So she came and got me on Sunday morning. And I don't remember much about that morning, but I do remember waking up in the morning and saying in my head, it was almost like there was a voice saying, you have to tell them how to get into the house. And I knew that I needed to give somebody a code to get in, but I didn't know who. And it turns out it was my friend that I had just texted. Yeah. So I texted the code to my house where she could find the key in the key box. She let herself in. And when she came upstairs, she found me unresponsive on my bed. She was able to wake me up when she touched me and got my attention, but I was just basically passed out on my bed.
Yeah.
And she was extremely worried. I remember hearing her say, oh my gosh, Katy, oh my gosh. And I remember thinking to myself, wow, I must really be sick. She's acting really unusual.
Mm-hmm.
So she got me up. She realized it was difficult to get me dressed. I was just not, ready to go to the hospital, but she just wrapped a blanket around me. And when we went to stand up, I was complaining that my feet hurt. And she had no idea what that was about. I didn't know at the time either. But what we ended up doing is she said, okay, fine, I'm going to sit you on the floor. We're just going to scoot across the floor, and I'm going to scoot you down the stairs, and I'm going to get you out to my car. So when we got by the car, she said, I really think maybe we should call an ambulance, but I'm worried because it's 20 minutes toward the hospital. It's really the other direction. I know that that's where they're stored.
Okay.
And so she said, how would you feel if we just put you in the car and we drove toward the hospital? And if we need an ambulance, I'll call one on the way. And we agreed that that was the best solution. I just wanted to get out of there. So she lifted me up, put me in her back seat, and, helped me into her back seat. I just laid down the whole way. And about 10 minutes out from the airport, our trip went great. We were able to get through traffic really easily, but about 10 minutes out, we hit traffic, and I started crying in the back seat and saying, Tiffany, are we there yet? My hands and feet are on fire. How soon are we going to be there? I'm really sore. This really hurts. And I was crying and whimpering. So she called the hospital. She called ahead and just said, look, we're coming in. She has at least the flu, but something more. Her hands and feet are on fire, and something's really wrong. She can barely sit up. She's barely conscious. And so they met us at the emergency room entrance with a gurney. They loaded me onto it. They took me into the emergency room, and they started checking my vital signs. They immediately determined that my blood pressure was 50/30, which is extremely low and an indication of shock. Yeah. So at this point, they know that I'm very sick. My hands are on fire, and I'm in shock. And I think at this point, I don't know for certain, but I highly suspect they were suspecting sepsis. And I will right now define sepsis.
Thank you.
Sepsis is not the infection itself, but sepsis is a body's dysregulated response to an infection. So basically your body overreacts. Your immune system sort of goes haywire. And instead of it shooting, going out, your white blood cells are just attacking the bacteria or whatever's causing the infection, your body starts attacking itself, and it starts causing tissue damage. So in addition to this infection that you have that's causing damage and inflammation in your body, your own body has turned on itself. And it's almost like you've become overwhelmed with whatever is causing it, a pathogen, whether it's a bacteria or a virus or whatever. You become overwhelmed with it, and your body just goes haywire and starts attacking itself. So it is a response that can sometimes happen to an infection, and that's what was happening within me. So they took my other vital signs. At this point now, my breathing rate is very heavy. I'm having difficulty breathing. I have an increased heart rate. Both of those are an indication that I have low blood oxygen. And they're realizing that my vital signs are not strong. I'm not doing well. So they bring me into the ICU, and they begin what we call a sepsis protocol, which is they draw blood from my body so that they can begin trying to determine what pathogen is causing the infection. And with sepsis, it can be caused by a bacteria, a virus, a fungus, or a parasite. So they need ideally to determine what's causing the infection so that they can get the right either antibiotic or antimicrobial that will kill whatever's causing me to be sick.
Sure.
And the best way of doing that is to draw this blood. Now, this is a lengthy process. It can actually take several days if it's a bacteria. And most often, by the way, sepsis is usually caused by a bacteria. So their first line of defense then is to begin administering broad spectrum IV antibiotics. And then also, they increase your fluids by a lot. They give you an IV with a lot of fluids. They push a lot of fluids in your body trying to increase your heart rate, your blood pressure.
Right.
And if that doesn't work, it's a good indication that you do have sepsis. So spent the day going through this. I had oxygen in my nose initially, and by the end of the day, it was being kind of pressed into my body with a pressurized mask. When you're in the Hawaiian Islands and you're on one of the outer islands, everyone pretty much knows if you become really sick, you're going to take an air ambulance over to Honolulu, which is the main Hawaiian city. And there's some really nice big hospitals there. So they're going to get you out of the small regional hospital, and they're going to get you into the state level 1 trauma center or one of the larger hospitals over there. And at this point, my family had been contacted. they were trying to reach my husband, who was out of contact because he was in, at a fishing river up in the mountains. And my 24-year-old daughter at the time, who had just graduated from college, was now the adult of the family trying to manage this. She actually had a friend who had sepsis 3 years prior, and her friend got as sick as I did, and she lost a leg to sepsis. So my family understood what the word, we understood what the word was. We sort of understood what it was, but like I say, we didn't know the symptoms. So I missed the symptoms. And now I found myself in this medical emergency that her friend had experienced. So my daughter was terrified. She was extremely aware that I could lose a limb or I could lose my life. And she's having to manage the other members of the family that she's contacting. I'm fortunate that I have a sister-in-law who's a doctor. So she took over my medical, sort of as my medical information specialist. So I was fortunate. So I was able to tell the doctor that I wanted her to be able to speak on my behalf. And I guess that all day long I was conversing with everybody, but I have no memory of that. So it's funny because I've talked about it. I'm like, I wish they'd let me talk to you. My daughter says, they did let you talk to me. I did talk to you. Wow. You just don't remember.
Right.
So I was under good care, and it was determined that the best hospital that we were getting advised by everyone who was now kind of consulting, which was a lot of people. It was friends of friends of friends. Everyone was reaching out to see if they knew anybody in the medical community. And it was suggested that I go to the Queen's Hospital over in Honolulu because they have hyperbaric chambers, which they use for dive accidents.
Right.
And those have been proven to do well for wound healing and for just general oxygenation of blood in your body. So, and that was sort of, we had multiple people who were coming to that same conclusion. My friends on Kauai were suggesting it, and the people that my sister-in-law, the doctor, was talking to. And then even one of my friends who came to be with me, she was inquiring around the Seattle area. And also people were saying, try and get her to Queens because they have these hyperbaric chambers and it might help with her circulation. So at this point, my hands and feet, I mentioned, were on fire. This, what was happening is that I had blood vessels. I had clotting and kind of bursting of blood vessels in my fingertips and in my feet. And it's a condition called DIC, but it's, I can't even think what it stands for. DIC, I just forgot the word for it. Sorry about that.
No,
but so I had DIC, but there's another thing that can happen that's common with people who have sepsis is that in order to treat it and in order to get the blood into your internal organs, they have to draw it out of your extremities. Your body will sort of start doing that on its own, but there's a medication called a pressor that a doctor needs to choose to give you. And when they make the choice to give you a pressor, if they give you a small amount, you'll be fine. But if they give you the increased amounts that are really going to push the blood into your core to try and save your vital organs, they know that they risk you losing limbs. And I've heard it described as the decision they make is called a choice of life over limbs.
Right.
And that choice had to be made for me. They had to realize they're like, we're giving you pressors, we're increasing them. They're called vasopressors, and they constrict your blood vessels and in order to raise your blood pressure. But if it's not working, which it wasn't in my case, they have to keep increasing the amount. And the more they increase it, the more dangerous it becomes. So with a combination of the DIC and the vasopressors, my extremities were at risk kind of this whole time. And the doctors certainly knew that. I think my family was aware of it. I was less aware, I think. I don't think I was. I know now from experience that I was in denial for a while about all of this. So I'm sure that I was already using that protective mechanism that my brain had to say, oh, you're going to be fine. You're going to be fine, So on that evening, Saturday evening, I was still in the hospital. The hospital that we wanted to get transferred to, all of the beds were full at the ICU. So we've all heard about with COVID, how we need to be concerned about overrunning our hospitals. This was just an ordinary weekend a year before COVID happened, and there was no room in our level 1 trauma center for me. There was another bed at another hospital, which is comforting, but we really wanted to get me to those, to the equipment that they had at that hospital. So on that evening, my hands began to turn purple, and I can only assume that my feet were also starting to do it. I didn't see my feet. And like I say, I think I was in a little bit of denial. So if they were talking about it, I was trying to ignore it. But I think that I was already having circulatory problems there. So in the morning, they'd gotten in touch with my husband. He was now on his way he had gotten out of Idaho to Salt Lake City and was going to fly to Honolulu. And then the plan was that I was also going to fly to Honolulu, and ideally we would meet there, which did work out well. So that morning, they talked to me, and I actually saw the paperwork that I signed, giving them authorization to intubate me in order to make me more stable for the flight over to Honolulu. Because one of the things I've learned is that whenever you transfer someone from a hospital, if they're in an ambulance or an air ambulance, in my case, or both, in my case, that's the biggest risk of losing somebody, because we don't have all the medical equipment.
Sure.
Mm-hmm.
So they realized that they needed to get me stabilized. So they put me on, it's basically life support.
Right.
They put a breathing tube down my throat. There was equipment breathing for me. I was put into a drug-induced coma, and they loaded me onto a gurney, put me in an ambulance, then onto an airplane that flew me over to Honolulu, and then into another ambulance where I drove to the hospital. And at this point, I had a good friend from Seattle who was there with me. She got the news on Saturday morning that I was in the hospital, realized how severe it could be, and immediately got on a plane to be with me so that she could support me, knowing that my kids were kind of in charge now. And she just said, nope, I'm going to step up. I'm going to be in charge. Your kids can manage from the mainland, and I'll help, manage the communications. So she was with me, and she flew to Honolulu with me.
Nice.
So when I got there, my husband was there, and he had been waiting for about an hour. I rolled in on a gurney, and he said I was unrecognizable. At this point, I had so much fluid in my body that I weighed as much as I did when I was full-term pregnant with both of my daughters.
Wow.
So I had started out weighing 114 pounds, and I weighed somewhere around 140 when I got to the hospital. I had that much fluid in my body. So I was just this huge swollen person, and I still was having difficulties. So he introduced himself to the doctors as they were whisking me by, and they just said, sit down, we'll be out in a few minutes. She's not stable, and took me into the ICU. So when they came out, I sat down with my husband, and they explained, that I was in severe septic shock, that they were concerned about me. They were asking him questions like, does she have a will? And does she have a healthcare directive? And do you have access to those things?
Wow.
So those were on the island of Kauai in a safe deposit box, or actually in a file at our house. And he called a friend and had him go to the house and get the file, and had arranged that the friend would fly over if it was needed. And obviously they were hoping it wouldn't be that desperate, but that was the plan that they had put in place. And then the doctor explained to my husband that he should call my children and have them come over. So at this point he was realizing, oh my gosh, they're concerned that she may not live.
Right.
And they weren't talking about it yet. I don't know that he actually said the words, but all the indications.
Right. From everything he was saying
and seeing. Yeah.
Right.
Oh.
Darn.
Yeah. So,
Katy, I'm going to backtrack. I mean,
yes, go ahead.
I have been like enthralled with your story. I am so sorry this happened to you, but let's review. What are the symptoms of sepsis? What do people?
You said time.
I know.
Right.
Let's go over it again, because this is so important, and you're being an advocate.
I will.
Yeah. So what's
I appreciate it. And
yeah.
one of the things I've realized in my advocacy is that not only do I want people to recognize the signs of sepsis, and I've done a lot. I've become really active this year on TikTok, which is a really fun way for me to make these short videos that sort of explain these things. And I figured out that I don't need them to diagnose sepsis at home or know that it's sepsis. I just need them to know that sepsis exists, and there are certain symptoms to look for when your body is in a medical emergency and you need to get to the hospital.
Okay.
So I'm hoping that by looking for the signs that I indicate today, that people will notice that something's wrong. I'm going to go to the hospital. I'm going to mention sepsis to my doctor and tell them that I want them to rule it out, because that's a really great step to take to advocate for yourself.
Okay.
And, but more importantly, I'm just going to recognize that my body's in an emergency. So the main signs of sepsis, which also could indicate another emergency, you might find something else when you get there. Sure. But whatever the case, your body's having an emergency. So temperature can be high or low. And that's really important that people know.
Right.
It always takes place with an infection. That's the, I mentioned the TIME acronym. So T is for temperature, I is for infection. But keep in mind that sometimes we have infections internally. We might have a bladder infection that we're not aware of, or that cold might have turned into bronchitis, and so we might have a bronchial infection, or we may have a polyp on an intestine that we can't see, or something internal that we don't even know about. That's not unusual for people to realize that they didn't even know they had an infection.
Okay.
But certainly if you know you have an infection, you want to look for any indication that you're becoming ill, your body's becoming sick, because that right there is a huge indication to get to the hospital.
Okay.
So the next symptom in M is mental decline. if you have the flu, you're generally not going to have mental decline. And that, as I mentioned before, can be just being confused, being disoriented, seeming drunk, or possibly even seeming like you have dementia, like just really confused.
Right.
And then E is for extremely ill, which is the I feel like I'm going to die, or I've never been so sick, are things that are often said.
Okay.
And it can be, you can at that time have aches and pains. You can be having stomach issues, sometimes diarrhea, sometimes vomiting. Any indication of flu-like symptoms, that you might have. You may have mottled skin where you have like little marks on your skin. Sometimes they can look like a bruise. Or a rash, but when you push down on it, it doesn't go away. It's like a little mark that's showing an indication that your blood vessels are having issues.
Okay.
And you might have cold hands and feet, or sore hands and feet like I did. Cold, clammy skin, any indication of those other symptoms. And then the other thing I always want to remind people of is to check. It's super easy to check your heart rate and your breathing rate. I think instinctively we know when we're breathing heavy or we're having difficulty breathing. It's kind of a
Right.
If it sounds like you've been working out, but you haven't been working out, or if you get up to go to the bathroom and it feels like you just ran half a mile, something's wrong.
Right.
So that's a concern. It means your body is struggling to get enough oxygen.
Okay.
So I always encourage heart rate and breathing rate. Both of those indicate low oxygen.
All right.
And certainly if you have that pulse oximeter at home that a lot of people now have because of the COVID pandemic, check out your blood oxygen levels and make sure that they're not getting lower.
Okay.
Good
advice.
So you were saying that the hospital had advised your husband that this was serious, and that they were, making sure that you had a will and wanting all your important documentation on hand, possibly. And where did it go from there?
Thank you. So now my husband has called my kids and said, "You guys get over here." And I think he was doing everything through my older daughter so she could maybe talk to the younger. I'm not sure. They may have discussed it directly. But so remember, I've got a daughter who's a junior in college. So she's trying to be in school and she's got this trauma going on. And we're trying to keep it, at this point, the family's just trying to keep it as normal for her as possible. And had my husband had first, when he got in touch with them, when he got back from the fishing trip, he contacted them, of course, immediately.
Sure.
Even before he got back, he contacted them and let them know, just stay put. We've got mom's good friend is with her. She's going to take care of things. She'll let us know if we need to go over. So his idea was he'd come see me and then he'd let the kids know. So then he made the phone call. That was the very difficult phone call saying, "Guys, it's time to come."
Yeah.
So my older daughter arranged to fly through Los Angeles. She was in San Diego, flew through Los Angeles. Her sister got on the same flight and the two of them flew over together. And they were able to see me, I think, that evening. That was Monday evening when they got into town. So I'm not sure if they saw me immediately or not, but they were there and had the option at least.
Okay.
And then they were able to be with me that week. So I did not pass away, as you can tell. So I spent 5 days in the ICU. And during that time, they watched my hands and feet turn purple. And the soles of my feet turned black and my fingertips turned black. So they were very aware that I was at least not going to keep my fingertips. It was really clear that they had died, and also my toes. So they knew that I was going to lose at least some of my limbs, but they didn't know how much. So eventually my husband went in and just said, "We've been waiting. We've been by her side. We're so worried. Can you please give me an indication of what we can expect her outcome to be?"
Right.
And they said, "Well, if she survives, you need to be prepared that she's probably going to lose her hands and feet." And so they had to come to terms with this. And knowing this without me knowing it must have been awful for them. The realization that they were going to, and I think there was probably potential there that they might even have to make a decision about amputations without me being awake.
Right.
So they were, I'm sure, not only scared for my life still, but very scared about all the things and all the changes in my life and what they were going to have to be telling me when and if I woke up. So it was very, very traumatic for my family. So on day 5, I was becoming strong enough and my vital signs were becoming strong enough that they felt like they could wake me up. And what they did is they withdrew the medications that were keeping me in the medically induced part of the coma to where I could kind of get my wits about me. And I remember them saying in my ear, "Katy, you're in the hospital. You have a tube down your throat. Don't try and speak. on the count of 3, we're going to ask you to cough and we're going to take the tube out. So they did that. It was way worse than they made it sound. It took several seconds to pull the tube out. It felt like I was vomiting. I couldn't breathe. I was really disoriented. And when I woke up, unfortunately, my hands went in front of my face. So I saw that my fingertips were black. So I'm coming out of this. I'm extremely disoriented. I don't know what's happening. I'm on like super heavy, ketamine type drugs. I mean, it's like, I'm really not in a good mental space. And I see these black fingertips and I immediately know that they're dead. And I don't know about my feet yet, but I am convinced that I'm losing my fingers. And I am so disoriented that in the beginning, it was just really super depressing. I didn't even know if I wanted to be alive. I was thinking that maybe I was going to lose my hands and feet. I was just really confused. I wasn't thinking clearly, but I was extremely upset. And my husband was right there, got in my face, kind of got me oriented. And it reminded me of when I had my babies. He was sort of holding onto my face saying, focus on me, I love you. You've been sick, you're doing better. I'm so glad you're here. And he was really trying to encourage me.
Yeah.
So we spent 3 weeks in that hospital with me doing daily treatments of nitroglycerin cream on my hands every 8 hours. And then being escorted on a gurney and then having to transfer out of the clothes I was wearing into sterile clothing. And then my gurney was lifted into a hyperbaric chamber where I spent 90 minutes. It's basically the equivalent of, it's almost like you're diving, diving underwater. They pressurize the room, the little chamber that you're in, and you have to clear your nostrils or your sinuses like you do when you're diving.
Right.
And then what it does is it takes you, the equivalent of taking you down, I think it's like, I don't know what it is, but taking you down 100, 200 feet, something like that. And it puts pressure on your body to hyperoxygenate your blood. And so you're able to breathe a really high concentration of oxygen in this pressurized chamber. And it not only oxygenates your blood, but it improves the healing process after you come out of it. It puts your body under stress and then it improves your healing. So it's a really effective treatment that they're finding for wound care and for oxygenation. So they're trying it on all sorts of new things. I don't think it's been proven yet for this, but they're getting really good results. And they're just sort of using it knowing that ideally it's going to improve things and it's certainly going to make nothing worse. So incredibly, we were able to reoxygenate my hands. They went from being purple and with just like it was just like a big bruised hand. They looked like all the blood vessels were broken, and they were able to reoxygenate them, get my blood supply back. And I only lost the part of my fingers that was black when I woke up. However, after 3 weeks, my husband and my family let me come to terms with this. They never said the word amputation. They never talked about having surgeries or anything until I was ready. And after 3 weeks, I looked at my husband and we were about to go in the hyperbaric chamber and I was going to have to change out of all my clothes again and do this thing that we've had to do every day. And I just looked at my husband and said, I don't want to do this anymore. I know we can't save my feet. And he just, put his head up against me again and just said, babe, I'm so sorry. He goes, he looked at the nurse who was helping me with the chamber and just said, we're done. We're going to go back to the room. Thank you very much. And when we got back to the room, became really clear that my family had been discussing this for weeks. They already had several plan options put in place, and they offered that I could stay in Honolulu where we didn't know anybody. And we were actually staying at a friend's rented apartment. And it just didn't make sense for me to stay in Honolulu. We didn't want to go back to Kauai because it was such a small hospital. And I knew that at this point, I'm acknowledging that prosthetics are going to have to happen.
Right.
And I knew that just wouldn't be available there. So we opted to come back to Seattle. And when I told him that, I said, we can't get from the garage to the house. I'm worried because we have this sunken patio that we have to walk over. And he goes, no. He goes, we've already put a ramp and we can take you from a wheelchair from the car straight into the house. And we've arranged for you to get a hospital bed on the main floor. And we've already got it all figured out. And so that was super comforting to me to know that not only did they have a plan in place, but just that they were being so thoughtful and so caring so much for me. So I came back to Seattle, and we ended up having to come by air ambulance. And fortunately, as I was crying as we left Oahu, looking out the window, I looked over at the nurse and she, it's funny because the last thing I remember is crying as we were leaving Oahu. And then I remember waking up in Seattle, and I realized now that I think she gave me something to sleep. I think she saw me crying and probably thought this is going to be a long flight with this poor woman having to sit here and cry. So it's really easy for me to give her a little something in her IV. And so I just slept the entire way and woke up in Seattle.
Good.
And was was taken by ambulance over to Harborview Medical Center, which is our level 1 trauma center here.
Okay.
And if you live anywhere in this area, you know about Harborview. They not only serve Washington State, but I think they also serve Idaho, Montana, and maybe even Alaska. I mean, so it's a big regional trauma center. So I knew that this hospital would have done amputations, and even if it was from car accidents or whatever, I just knew that they would have more experience with what I was going to need to have done.
Sure.
So it felt very good coming home. I was sad to leave, but I was really glad to be in a place where they had great medical care.
Right. Katy, how common is sepsis?
It's far more common than we think. First of all, for those who haven't heard of sepsis, I don't want you to be feel like you're just totally out of it. It's not a lot of people have heard of sepsis. I think we were up in the range when we would do surveys that like over 70% had heard the word, but it was still far less than 50%. I think even more in the 20 to 30% range that could actually identify any of the symptoms. And now that we've had the pandemic, healthcare in general has kind of backed up a little bit. We're down more to only 65% of people even knowing what the word is. And so it's more common than anyone realizes. It's a word that everyone should know. Thank you. You just put up some statistics, which is exactly what I know. What is that going to mention? And that's 1.7 million people in the United States get it per year, and at least 270,000. That was the number that we used before the pandemic. Now we've moved that up to 350,000 die from it every year.
Wow.
So you have about 1.4 million people every year that are surviving sepsis. Some of them, like myself, who are losing limbs and having really serious outcomes. And many of whom, like over 50%, who are experiencing post-sepsis symptoms, things like just confusion, memory issues, depression, anxiety, pain in their extremities where they had blood circulation issues, even if they didn't lose limbs. It's called neuropathy, like nerve pain. Lots of different symptoms. I had damage to my voice box from being intubated. People have difficulty sleeping. I still have difficulty sleeping. So it impacts a lot of people, and you do not need to be sick to have it happen. It is more common in the elderly and in neonatal, new babies that are born early or very young people, but it is, or people with chronic illnesses or immunocompromised people, but it can happen to anyone like myself. I was very healthy when it happened, and that's not unusual.
Wow. Well, and I know we have heard of sepsis. My daughter was a medic in the Army. But had you ever heard of sepsis before?
Well, you had heard about it from your daughter's friend.
Yes, I had, and I became more aware of it when our friend got it. It was one of my daughter's young friends that had gotten it. And I was shocked at that time, 3 years prior, to learn that you could lose a limb to it. And then I realized that this is that thing I'd heard about on the news when I'd seen people becoming multiple amputees because they just got sick from something.
Right.
And I was under the impression that it came from, swimming in dirty water or getting, I just assumed it was something really extreme. I didn't know that it could be something as simple as
something exotic. Right.
Yeah. And then the friend that had gotten it, she got it from strep throat. So I knew that, and that is very common. Right. So I understood at that point in time the importance of getting antibiotics early and then taking all of your antibiotics. That was sort of the message I got out of her event. But I didn't take the time to learn the signs and symptoms. So that's why I really want people to make sure they know that, just like you would want to know the signs of a heart attack or a stroke, you should know the signs of sepsis.
Right.
And I guess we're all very grateful that you had someone nearby and close friends and an amazing family. So, that's all absolutely fantastic.
Yeah, for sure.
And what was the most challenging aspect? I mean, you were in the hospital for a long time, but what was the most challenging aspect of being in the hospital and being in the ICU?
Yeah, the biggest thing, so the first thing I would say is coming to terms with the whole amputations and immediately I'm coming to this reality that I'm really sick as I wake up, but then I'm seeing that my fingers are dead. Yeah. So, and that was extremely hard for me to process. And especially in this confused state that I was in, which brings up the second difficult thing, which is called ICU delirium. And it's extremely common for someone that's been in the ICU. The longer you're in there, the worse it can be. For me, it lasted 8 days. And this is not just mild confusion. This is like dementia-like confusion. I was hallucinating. I was talking to my husband nonstop about things that hadn't happened. And I also had my older daughter was there as well. She took some time off work to be with me. And I was just constantly talking about things that weren't actually going on. I was saying things like, I didn't know if I'd paid the medical insurance. And I thought people had, had hacked my computer and stolen all of our money from the bank. And then I thought they were able to get from my bank account into my husband's business accounts and that they'd stolen all of his money. So I'd close my eyes and I'd hallucinate, and then I'd wake up and I'd tell my family all these crazy tales. And that lasted for 8 days. My husband really did think I had brain damage. He was really concerned about that. And I feel like it's something, ICU delirium is very common, but I feel like it's something that isn't necessarily explained as well to people as it should be. So that's one of the things I like to do too, is normalize that when you spend time in the ICU, it's not unusual for, up to a week or even a little bit more to be extremely confused and even have hallucinations during that time.
Okay.
Sure.
And none of that was due to the ketamine or other medications that they were giving you for pain and things?
It probably was due to that. Okay. I don't think they know exactly what the cause of ICU delirium is, because you can't separate out all the things that happen.
Right. If it's medicine or is it the body? Right.
Yeah, you're overhearing people day and night. I'm sure they were talking about insurance, and then I had some nightmare that I hadn't paid for. Yeah. I'm sure I heard some of the things that they were saying, and it was causing me to come up with some of my hallucinations.
Okay.
And we've seen the delirium as well in several cases with our family members. When my grandfather had he was actually dying from a hepatitis and a cardiac condition, and he thought that the gentleman who was in a coma across from him was going to blow up the hospital, and was very insistent that that was going to happen. And then my cousin, who was also dying of a liver disease, thought that she was president of the United States and tried to punch someone when they wouldn't follow her directions.
That's funny. I told my sister-in-law at one point, because I knew that one of my sisters-in-law knew someone who worked at the hospital. I had in my head twisted it around that I was a special guest of the hotel. I thought I was in a very fancy hotel. And that I was a special guest of the president of the hotel, because in my head, there was a president of the hotel that I was in.
Sure.
And at one point I said to my sister-in-law, do they know that I'm a special guest? And she said, cute. She was really cute. She just touched my arm and she said, Scott will explain it to them. And so at this point, they were getting used to my delusions, and she was just going along with it, which honestly was the best way that they could handle it. Because when they tried to tell me things weren't real, I was confused. But if they just went with it, then I was like, okay, great. You're taking care of it. You know?
Right.
So that was helpful for me.
Okay.
Excellent.
Because that's and did they brief your family at all about that so that they knew what they were seeing? Or
I do a lot of advocacy now, sort of as a patient advocate, and I think that there's a lot of if you think about why you're in an ER and certainly why you're in an ICU, they're there to save your life.
Right.
And they are focusing on saving your life.
Okay.
And with that obviously comes communication with the family, but I think that sometimes in these high stress situations where they're, we're literally life and death situations, I think sometimes some of the steps get skipped or they're just glossed over. So yes, I think certainly they did say, this isn't unusual. We see this sometimes.
Right.
But I don't think they really stated saying it's really very common and it could last as long as a week and she might seem completely crazy, but don't be alarmed. I don't think they really stressed that as much as they could have.
Okay.
And when I speak to patient groups or hospital groups that are looking at patient experience, I always stress that there's probably ways that they could communicate with both the patient and the families a little bit better. And I know that they care about that kind of feedback. Sure. And they try to take it into account. And I'm sure sometimes it's handled perfectly. And I was a very, very high risk. I mean, they did not expect me to live.
Right.
And they were doing everything they could to try and save me. So I would say at the bottom of the list of important things for them to do, this was near the bottom, was trying to explain all this to my family. Okay. So I don't really fault them in it, but I do think that there are systems that could be put into place that might make it a little bit more clear to people. They could maybe manage it differently or just look at the way to change systems within different hospitals to let them know, let patients and families know a little bit more about what's going on.
Good advice.
And Katy, are you aware of any innovations or research that's being done to help prevent or increase the rapidity of diagnosis or the treatment of sepsis and anything in that region?
I am. So I work with a company. This is just one of the companies, but I'm going to use them as an example.
Okay.
I just did a talk for a sales group at a company called T2 Biosystems.
Okay.
And they're an example of a company that is innovating to try and speed up the diagnostics for sepsis. And I mentioned before that, if they're taking a Petri dish and trying to put a sample of my blood onto it and they're waiting to culture it out, it can take many days.
Yes.
And the quicker that they can target an antibiotic, or maybe even determine that it's not a bacteria, maybe it's a virus that's causing it. So the quicker that they can identify whatever that pathogen is, the quicker they can get you an effective treatment, and it can save lives. So they've got a program, or they've got a system available that they can actually take whole blood. They can do it much more quickly, and within hours, they can determine what the pathogen is and therefore target the antibiotic.
Wow.
So that's just one example. But basically, with Sepsis Alliance, which is an organization that I'm involved with, I'll talk about that a little bit more in a second, but I'm on the board of directors and I do a lot of education, and I use their information and materials because they're the leading sepsis advocacy group in the country. And I just lost my place, so you're going to have to edit.
No, that's
this,
okay.
sorry.
That's okay. We can edit.
With the Sepsis Alliance.
Okay, what was I telling you? Can you ask the question again?
You were telling us how the Sepsis Alliance and the
T2 Biosystems is helping
innovations,
yes.
Right?
Yes.
Okay, perfect. So, with Sepsis Alliance, we've started a collaborative of people within the industry that can get together, all of the great minds that can think and try and problem solve to help increase the diagnostics and increase the treatment as best as we can. And then we're also trying to educate people so that they can identify it more quickly at home and get to the hospital sooner. So all of these things, educating the public, getting them out there, and then improving more rapid diagnostics and improving the care and the development of antibiotics. These are all things that are going to make a difference. There's a lot involved in the public health about why these are challenges that we won't get into, but we are really helping bring the right people together, and there are companies on their own that are working on it. And then at the national level, we're even trying to get programs in place that we can make it more profitable to develop new antibiotics, because right now it's not profitable to develop antibiotics, and we've got to make that change because of antimicrobial resistance. We know that some of the ones that used to just be 100% reliable aren't always working anymore.
Right.
So we've got to get new products onto the market. So all of these types of things are taking place now.
Okay.
Good.
That's great.
Katy, what role has mental health care played in your recovery?
Yeah, you've been through an awful lot.
I mean, like, you've been through the mill.
Yes.
Yes. Yeah. Mental health has been a huge part of my experience and my recovery. So you can imagine that finding out that you're going to lose your beautiful fingernails and your manicured toes, which, by the way, I had like beautiful nail polish on my purple toes. It was horrifying when I woke up. And my nails had never looked better. They were like all long and thick on my purple fingertips. It was crazy. But so coming to terms with the fact that I was losing parts of my body was so incredibly depressing. And I just felt hopeless, and I felt depressed, and I was scared for my future. It made me anxious. And then the hospital experience gave me huge PTSD. And just, even like when I talk about that trauma of waking up, I can visualize that light and my husband and seeing my hands. And, so I've gone to therapy for it. I take antidepressants. I'm fortunate that I don't have so much anxiety that I need treatment. However, I don't sleep well. And so I do take something to help me sleep. Even now, it's been almost 4 years, but I'm still kind of taking something to help me fall asleep at night. Because every night when I crawl into bed and when I wake up in the morning, I'm an amputee. I don't even have my legs on. During the day sitting here, I can feel my legs underneath me. They're touching the floor. I have my legs on. I feel like, I don't notice that they're missing. My hands, I've gotten so used to that I don't even use prosthetics, and they function fine. And I've really adapted well over the years. But when I'm in bed, I take off my legs and I realize it's 30 seconds at least. I've timed it. I can get them on in 30 seconds if I have to get up and go to the bathroom. But I lie there and I just feel really
naked,
disabled. I can't just get up and walk away. I need to take the time to put my legs on.
Right.
They're uncomfortable. And so anyways, mental health has been big, just coming to terms with this, but I've had really good treatments. It's been successful. The antidepressants helped me. The treatments have helped me. I've even had really good treatment for PTSD that's been extremely effective. And there are things out there. So I really encourage people going through any medical trauma. Psychiatric care has to be a part of your process for not only you, but your family and friends as well.
Sure.
Absolutely.
It was horrifying for them as well. And they've been through this, and this has impacted their lives.
For sure.
Yeah. And I will say that your prosthetic pedicure is beautiful.
Your
I think you posted that online. And it's absolutely beautiful.
Thank you. Yeah, I have these cute little plastic feet that look like my old feet, and I was able to paint my toenails. It made me feel good. The feet I wear now are blade style, like the running blades, but instead of looping back behind my leg, they come straight down so I can wear pants.
Okay.
But they give a little bounce in my toe, and they're very lightweight, but the feet are just little black. They look like I wear little black slippers, and it's just a carved piece of foam. So I don't get to have those pretty nails, but it's worth the trade-off because they're very comfortable. So I can alternate depending on if I want to wear sandals or not, which is nice.
Yeah. They were, because I saw those and I was like, oh, that's so cute.
I wanted to mention just quickly on mental health too.
Yeah.
I think the importance of support is really huge.
Okay.
So either through a support group or even just taking advantage of the doctors and all of the physical therapy and occupational therapy and things like that you sometimes do after an event like this, just really just benefiting from contact with other people, looking online to realize that you're not alone is huge. Just look up some Paralympians in my case, or look up sepsis survivors, or just kind of search a little bit out. You can find people who've maybe had like a chronic illness or something, and you start realizing there's a community out there of people who've suffered medical trauma that's really strong and vital. And I've found people online, cancer survivors and things like that, who I can really relate to. And just the support of my family, my friends, I go to some support groups. There's support groups available for me locally at Harborview Medical Center, but for amputees in particular. But there's also support groups online through Amputee Coalition and through Sepsis Alliance. We've just started a support community. And so we're supporting survivors, their families, their caregivers, including people who've lost loved ones. And so there's things that you can get out there that you're not alone. I mean, I think it's just really important not to completely isolate.
Okay.
Good point.
Yeah, you have wonderful advice. And I think, anyone who's recently dealing with this and coming to it will really value your experience and all of your advice as well. Yeah, we can all learn from.
Right. And I know that you were a jet-setting entrepreneur, go-getter before, but now you're an advocate on top of all that for sepsis awareness. Was that just like an automatic thing? You just said, I have to do this?
Well, it's funny because I was a bit of a jet setter because I was a stay-at-home mom whose kids were now in college and one is now graduated. So I'd been spending the last couple of years since my younger daughter had entered college, really trying to brainstorm and figure out what was next for me in life. Because here I am, a stay-at-home mom without kids, which I would sometimes refer to as being retired. But I was really looking for my next step. And I was honestly, I had got involved with a fundraiser locally to raise money for a playground in our little town. And I was starting to figure out what I was passionate about because I really wanted to volunteer some time and possibly get on a board of directors. I was thinking maybe with one of the schools that my kids had gone to or something like that. And it's funny because this situation bounced me into a position where I was able to meet the head of the Sepsis Alliance.
Oh, okay.
He came up to Seattle for a sepsis conference, and he had seen that I'd done a fundraiser while I was in the hospital and raised quite a bit of money from my friends and family donating to Sepsis Alliance. And this organization had been super helpful for my family. And so I thought, I want to give back to them. And this is a great time to do it. While I'm doing this, it can be something I can do positive from the hospital. And he came, met me, we talked a lot about my story. And then he got back to me afterwards and said, we would really love you to join the board of directors of Sepsis Alliance. It'll be amazing to have a survivor and to have an amputee on board. And we think your story is powerful, and we think you could share it and educate others. And so they gave me this platform and this opportunity to do this. And over the past few years, I've been improving these skills and talking at sepsis conferences and doing different things. And it just sort of has evolved. But it's funny because I always joke that you have to be careful what you pray for, because I was literally praying to say, what's next in my life? And this is what happened. So at this point, I'm really extremely grateful because being able to share my experience and to help other people and to hopefully keep people from ending up where I did is just so meaningful to me. So, I mean, I am giving to others in doing this, but it's also giving back to me.
Oh,
it's giving me a purpose that I didn't have before. So it's really been, I mean, it's crazy to think that something like this could be for the better, but I mean, I think at this point, I feel like I came out somewhat ahead.
Yeah, for sure. Now, I know that you already explained before how your family and friends assisted you on your journey.
Yes.
Do you have any advice for family and friends of someone who recently had a limb loss?
Yeah, I think a few things. So first of all, encourage them to not worry about other things and to focus on their healing process. Because oftentimes with a limb loss, whatever the situation has been, they've been through some type of trauma and oftentimes a serious illness. So this is a person who needs to get back into shape and who needs to start strengthening their body maybe from a time in the hospital. And so anything that a family can do to help take away some of the burdens or maybe to fill some of the position that they had maybe had in their life prior. In my case, I was the main bill payer. I was in charge of the household. And so my family, by the time I woke up, they'd had a week to start thinking about things. And they immediately kind of explained to me, said, hey, look, we've contacted the bank. We're getting the bills paid online. They sort of told me how they were going to take away some of my responsibilities. They lifted this burden off of my shoulders and made it really clear to me how they were going to manage that without me, to give me the confidence that I could just focus on myself. Whenever I started asking questions, they would say, don't worry about that. We've got it covered. You just focus on your healing. Try and eat a good lunch today. Try and get some sleep. These are all things that are going to help with your recovery. And those, it seems really basic in the beginning, but that's all so important. I had lost 25 pounds, I think. I weighed in the high 80s. I started at 112, and I think Scott remembers I definitely weighed like 88 or 89.
Oh my gosh.
And I was considered severely malnourished. So I had to get strength and I had to try and keep food down.
Yeah.
And I had been on broad spectrum antibiotics the whole time, which had been keeping me sick. And so, my job was just to try and sleep as much as I could, take the medications, manage my pain, and try and eat. So that's how you start. And then just take it with baby steps. Just know that you've got to have tremendous patience, try and get them comfortable, bring in help if you need it. In our case, we brought in a nurse. It's not cheap to do that. I realize not everyone can do that. Use friends really give friends specific ideas about how they can help. In my case, we set up a food train, but we also had it, if the nurse was not going to be available, there were people who could drive me to appointments. There were people who were willing to come and bring me lunch, which they did for several months. I mean, I had a food train going for, I think, almost 4 months. And most of my friends delivered food 3, 4, 5 times over that period. But they knew that it was hard for, I couldn't stand up. I couldn't use my hands. And so they just didn't even want to burden my family with having to cook. And that was an absolutely ginormous help. But also like being able to get people to drive for me or just come and sit with me. I had people with me, every couple of days that were coming over, and I could talk about what was going on. And it was just really empowering for me. For people who don't have a huge network, like I say, utilizing the resources, you're going to be going to occupational and physical therapy, get to know those people, talk to them about your experience, share it with your doctor. I made friends. I didn't get out a lot. So it's like, if I was in a Starbucks and we had to get me into a wheelchair and I would go in, but if I could be at a Starbucks or something, I was always chatting up the people behind the counter and just trying to have social interactions, because that really improved my mood and my spirit.
Okay.
Good
Great.
advice.
Yes. Wonderful advice. Thank you. And what has surprised you the most about living with prosthetics?
I think the biggest thing is just realizing that I could almost get back to, it's not the same normal. I mean, it's not the same life I had before, but I could do a lot of things with prosthetics. And that I think also with my fingers, I not only lost my legs, but I lost my fingers. I tried out different prosthetics and I had them available to me through insurance, and I was able to try different things and come to the conclusion that for me, in my case, where I had more than half of each of my fingers, I was able to do most of the things without prosthetics. But then to realize that the legs that I had, I was able to walk. Eventually I was able to drive, and I could go on, and I could do small hikes, and I can get up and down stairs, and I was able to stand up paddle I was even able to snowboard, and I learned to wake surf eventually. so I was able to get out once I figured out the logistics of like, if my leg falls off, I put a little kid's arm float around the bottom of my prosthetic, and I blew it up. Okay. So it was hanging on the ankle so that if my prosthetic leg fell off while I was doing something, it wouldn't sink. And so, just trying to figure out creative ways to do things that I'd done before, I was really surprised how much I could actually get back into.
All right.
Very active lifestyle.
Also, I'm looking. Mm-hmm. Sorry to interrupt. No. I also just want to mention that I mentioned this before, but just like going online and realizing I am not alone. There's 2 million amputees out in the world. And there's Amputee Coalition has an annual event that they do. They had to stop it during COVID and make it go online, but it's an Amputee Coalition conference that they do, and they move it around the country in the summer. And so I was able to go that first year and see other amputees doing things, and that really inspired me. And now I've gone back, and it's almost year 4, and now I've gone back more as a leader. I got certified to be a peer support person, and I didn't mention this earlier, but also when someone is a new amputee, get in contact with Amputee Coalition, which you can find online. It's amputee-coalition.org, but you can just look up the Amputee Coalition and request a certified peer visitor to come, and you'll get another amputee to be able to come in and just listen to your family member who's a patient, and just to be able to empathize with them and kind of encourage them and inspire them, to let them see that life can be okay with amputations and that there's a future ahead for that person. That's really inspiring. And I'm now, like I say, I went back the first year and I was just eyes wide open, amazed at like how incredible all the other amputees were and inspired by them. And this time I was able to go back and inspire people and get certified to be a peer visitor. And then I also do advocacy with Amputee Coalition. It's another place that I volunteer.
Oh, that's excellent.
So it's really nice to be involved. And even these volunteer activities, they're healing for me because they're social interactions, and I'm bonding with other people where we have often other people who've been in the situation that I've been in, and at least where we have a passion about it. Anything like that really can improve the outcome for somebody.
Oh yeah, for sure. We got to get her to meet Travis Mills.
Yeah. Oh, you may already have met.
Have you listened to any of our podcasts?
You don't have to.
I've listened to him a little bit. Yeah.
Okay. No, is
Travis Mills on there? I'm right.
Yeah,
he
is. Yeah, he's a quad amputee from Afghanistan.
Well, he's not from Afghanistan.
No, he's from the United States, but he was in the Army and put his backpack down. Yeah. But he is, he's also like you. I mean, like
just gets out there and does motivational speeches.
He turned his life from, what you could have been oh, woe is me to, oh no, oh, woe is the world because I'm on fire and you're going to be my
next
audience.
Inspiring.
Yeah.
Yes.
Yeah, you're taking the world. That's great. Do you have any advice, Katy, for somebody who's taking a long flight, let's say from Hawaii to the mainland, something to get comfortable on those long flights?
Especially somebody with a chronic illness or something. Yeah.
Yeah. Okay. So my first tip for anybody is get the wheelchair at the airport. So either you can bring your own, which is great. And obviously if you bring that's not obvious. So you can check your wheelchair, but don't do that. Bring your wheelchair, go in your wheelchair, ask for an escort. It will cut you through all the lines. Certainly if you're traveling international. My husband and I literally high-fived each other when we got through customs coming back from a trip that we just did, because we literally walked through in like 4 minutes. And we sat in first class so that I could have a lie down seat because it can be, it can be uncomfortable.
Sure. Right.
I realized not everyone can do that. It's not always easy to do, especially on a long flight like that. So just getting extra leg room is really huge when you've got amputations or when you have medical needs. It's just that little bit of extra space in front of you can make all the difference. But we were on the front of the plane. We were the first ones off on this trip that we went on, but there was a plane ahead of us. So the entire customs area was just wrapped back and forth with people waiting in line. We walked right past that line, walked down to the end. We were the first people. We showed our passports and we were out of there in like a minute. It was the craziest thing. Literally, we looked at each other and high-fived each other and went, that was crazy. I can't believe how fast that was. So one of the perks of being an amputee and being in a wheelchair is you do sometimes get to cut lines. And it's not for no reason, because I've also stood in lines and it's really painful to stand in lines. The hardest thing I do is just to stand.
Sure. Mm-hmm.
And so I have a little bench that I got at like just a backpacking store that's like a little, it almost looks like a tripod, but it's a bench, and it looks like a little tripod. It's got a little strap that goes over my shoulder. It weighs next to nothing, but I can be standing in line at, waiting to go through security or whatever. And I can just set this little chair down on the ground, push it out, and it's got like a little hammock for my butt. And I just sit down on that thing, and I can just
take the pressure off. Yeah.
And wait. Yeah. And I'm sitting, up 18 inches off the ground, and it's a little bit silly, but the other thing is I always travel in shorts. I always show my prosthetic legs when I'm traveling, or if I'm wearing pants, I pull them up so that people can understand why sometimes I might get on the plane ahead of them or things like that.
Right.
Because otherwise I tend to look a little bit just like a normal person if I'm wearing pants, because I can walk pretty well. So they don't realize that although I walk well, it's still difficult for me to have come all the way through the airport.
Absolutely.
Yeah. Also, let's see, what are my other tips? And then other tips are things like make sure you load movies onto your phone or your electronic device so you can watch movies, because that can help a long flight. Have a good book. I use that time to clean out my email. It's the time that I go through and get rid of all the junk mails or the messages that I just want to delete off my phone. I don't do that real regularly. So I could sit there. I've done it before and sat there for a couple hours clearing off, just cleaning out my inbox. So I usually just try and make sure I'm doing something. And then sometimes I try and sleep for a little bit as well.
Okay.
All right. Good advice.
Yeah. Wonderful advice. Thank you.
Oh, I have one more.
Yeah.
Get a really good roller bag. The ones that someone carried my bag out for me one time because it was a little bit bigger. And he said, if you don't mind, just push my bag, because he was behind me and his bag was in front. So I grabbed it, and it was one of the stand-up bags with 4 wheels that you can push that way.
Yeah.
Whereas mine was the kind that had 2 wheels where you lean it back.
Right.
Game changer. I touched his bag. I pushed it off the plane, and then I got home.
And you went and buy one. Yeah.
Yeah. And you can find them on sale. I mean, they're not so brand new that they're like all super expensive, but the ones that stand upright, you don't carry any weight. You just push the thing. It's amazing. And so I got one of those, and I use that for all my travel. And I usually carry my prosthetics on the plane with me so they don't get lost.
Oh.
And so I've got a bag with stuff in. I have 2 prosthetic legs. So I've got, I have potentially 4 or 6 prosthetics that I can bring with me. I mean, I have prosthetic fins that just go over my shins, so I could have them with me. And I have feet that I can adjust at the ankle that I got this year because my daughter just got married. And I really wanted to have high heels. So I was able to get feet that adjust at the ankle for that. Insurance did not cover those. The way that my insurance plan worked, they wouldn't cover an ankle that moved. So we ended up taking care of that on our own. But and then I have the old feet that I got before my athletic one. So anyways, I sometimes will travel with 2 to 6 legs with me, and I'll put those in my bag and just put them overhead. And oftentimes people will be kind and help me get stuff overhead too. It helps that I'm also very small. So
yes, you are a very petite woman. And what's next for the Sepsis Alliance?
Okay, so September is Sepsis Awareness Month. And that's something that Sepsis Alliance started, I think, back in 2011, if I'm not mistaken. But and we've slowly been rolling it out and getting it into more and more states. I think over time we've had advocates reach out to the governors in various states and get it declared every year. Every year we have to get it redeclared so we can get a certificate from each state. But regardless if it's declared or not, it's always Sepsis Awareness Month nationally. And this year we've started a new program where we have an advocacy director, and we're trying to get patients and families involved in nationwide advocacy, both at the local and national level. And we've always done it nationally, and we've done it somewhat at the local level, but it's been a little bit less organized. Now we're really trying to get it in every state, and to try and get our survivor community and our families and caregivers really active in not only learning about what's going on with their patient or with the person who had sepsis, but also to advocate for things that can make a difference. So in that, one of the first things we're having them help us with is getting sepsis declared in each of the states. And we've gotten quite a few this year. And I think we're aiming for 100%, but I don't think that that'll probably happen this first year of doing it with our new advocates. But we're aiming toward that. And then at the end of the month, Sepsis Alliance has a sepsis summit. And I think it's the 28th and 29th, and anybody can sign up online at sepsis.org. It's an online program that'll be going on for 2 days with a lot of information about sepsis and what's going on in the world of sepsis. And then the other thing that I mentioned earlier is that we have a new program available that's called Sepsis Connect, where we're getting family members, survivors, and caregivers together. We're doing support groups online, and I'm hoping to start a specific support group for sepsis amputees this fall. And I'm hoping that that'll be so successful that I'm able to kind of groom some of the people in our first support group to then become leaders, and we can have multiple for sepsis amputees, because there are quite a few of us out there. And I think we spend a lot of time taking off one hat and putting on the other. I know half the time I'm a sepsis advocate, half the time I'm an amputee or disability awareness advocate, or I'm having those difficulties that I want to talk about, but it always seems like I'm in a room where it's either one conversation or the other. And I'm really excited to put a room together where we can discuss both at one time, because there are a lot of sepsis amputees out there.
Yeah, for sure.
That's amazing. Well, Katy, thank you so much for taking the time to talk with us today. I'm sorry that we made you relive all of that and rehash all of that, but we really appreciate it. How can our listeners learn more about you and your advocacy work and get involved?
Oh, thank you so much. So first of all, I would point you to, just in general, where I'm getting a lot of my information is sepsis.org, which is the Sepsis Alliance website, and also amputee-coalition.org, which is the Amputee Coalition website. So those are my two hats there, the sepsis and the amputee hats. Both of those organizations, they're the leaders in the United States. They have tremendous services available. I encourage you to get highly involved with both of them. And then you can look up Katy Grainger and sepsis, those words together, on Google or any of your browsers, and find a few articles, some podcasts, miscellaneous videos that I've done on YouTube and that are sort of out there in the world. And then you can find me on social media, on Facebook and YouTube. I'm just Katy Grainger, KatyGrainger. And then on TikTok and Instagram, I think I'm Katy Sepsis Amputee on both of those, but you can also find them with my name.
Okay.
And like I say, I've gotten really active on TikTok in the last few months. I started in January, and I biggest following. I have 44,000 followers, I think.
Okay.
And so people have really enjoyed and been interested in hearing my story and sort of learning about sepsis there.
Right.
So I encourage you to, come and join my community on any of those websites. And I'll keep you in the loop as I'm learning more and more, and as I'm sharing more of my story and learning more about sepsis and amputation.
Great. Thank you so much, Katy. Thank you. And
thank you so much for having me.
And we were going to post this in October, but we're going to shuffle it, and we're going to be posting this on September 20th.
Oh, you're amazing. Thank you.
And we'll send you links the weekend before so that you can share it with your tribe.
Wonderful. Well, you guys are doing amazing work. Thank you so much.
Thank you.
It was a pleasure to speak with you, and great to see you. Everything you're doing is just so impressive.
Yeah, we're very impressed.
Inspiring.
Thank you so much. I really appreciate it.
Thanks. If our listeners have any questions or comments related to today's show, contact somebody else. They can contact us at PodcastDX.com or PodcastDX@yahoo.com, through our website, PodcastDX.com, on Facebook, Twitter, Pinterest, TikTok, or Instagram.
And if you have a moment to spare, please give us a review wherever you get your podcast.
As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime. And never disregard professional medical advice or delay in seeking it because of something you've heard of this podcast.
Till next week.